it's an honor to be here and presenting again to this wonderful audience. I will quickly just start off. Just a quick disclaimer, I'm not going into a lot of detail today about trauma, but I am going to be talking about grief reaction and incorporating discussions of how trauma can impact that. So at any time, even discussing grief and loss, or dealing with emotional topics that can be triggering or unsettling, or maybe it's something that some of our audience just hasn't explored in this kind of setting. I really want you to be aware and take care of yourself during this. And if you feel like at any way you're being triggered, definitely shut down the presentation, take a break, do whatever you need to do to be aware of that and feel like you have the right to be able to pause and focus on what you're feeling, or seek out some help with somebody else, or even, you can send a message. But I just want to definitely talk about that before we get started today. I will do my best to try not to get into too much of that detail, and since this is a pretty brief presentation on a really large topic. And so first, I just want to talk about, and I want you to think about how somebody would define grief, and how maybe our society defines it, and how you yourself maybe would word that differently, or how you would maybe even express it a bit differently. And just take a second, and you must, if you have a notepad or your a piece of paper, it's really important to do some internal exploration of what does that word mean to you. What does it mean in your society, in your culture, in your personal or religious views, or what have you thought about it? Have you put much thought into it? And so I'm not sure if I can see, oh, here, maybe I can view some of the chats. If some of you have some chats too, and I ask a question, you can definitely type them in here. I think I can read them. But we want to think of grief as a reaction to loss. Yes, and someone said deep sadness as a result of loss. And it's looking exactly at that feeling of sorrow and that internal experience that we have, and that people may not be able to actually see, but it's that internal feeling when part of us is lost. And it could be losing a person, or it could be losing part of ourselves, part of our identity. It could be losing an expectation or a vision. It can be any response, but it's the energy and the network with that you're thinking and feeling that really doesn't expose people to this. It's a real private experience. And I want to highlight it's natural. It is very natural to experience this grief, but it doesn't require death. And I think that's one of the things in society and our communities where we automatically pair grief with death or loss of a physical connection or availability of a person. So I do want you to think about that and look at your definition. And you can definitely feel free to share them. Thank you for Alicia for sharing that. And here's where we go into a little bit more about how grief is not just about loss of a physical person in your life, but there's well over probably this slide was just on 40 events, but I'm sure there's way more once you sit and really start to process the levels of feeling disconnected or not having access to something that you once had in your life. And so our session today is not going to focus on all of these. I'm going to be focusing on the loss, the death of a loved one. So I'm doing that because this is a very short period of time, and I really want us to hone in for you to have an overview of what it's like in the field of psychology, to be working with patients and having to navigate and help them understand loss with a loved one, and the complexity of dealing just with that before going into all the other types of grief they could be experiencing when they walk into your office. And looking at the difference between that internal feeling of grief, it's the cognitive functioning, it's the internal emotions, it's your reaction that is part of that loss. And the mourning is the way that you're feeling and showing that sorrow. A person who is in mourning may have a period of time where they believe they are able to, or feel free, or just even they're unable to prevent showing the how this immense loss has impacted their ability to go through life. So there's a period of time where a person takes that grief and they express it. It's part of that process of how do I show my grief. And so it's taking that internal grief into this external and displaying, how do I deal with this? How do I behave? What do I need to do during this time when I notice this separation from something that probably helped define us as a human being? And so you can think of the mourning as a piece where you're actually showing and sharing your grief. And it may even be just with yourself. It doesn't always have to be public, but it's an individual feeling of, I'm not going to hide this. I am going to show this. I am going to display this. I am going to acknowledge this. And we're going to talk much more in this presentation about how some people really struggle with these different areas, even though the definitions I think we've heard quite often. When you think about your individual reaction or somebody that you love going through this, it's a very personal situation that isn't as simple as these broad definitions that we hear. And the bereavement is the experience. This is what we go through. This is our journey of loss. It's going through the incorporating the way this has changed our ability to think and perceive the world. It's going through and feeling how our emotions have changed, how they've adjusted, how they've maybe been consistent, or how maybe we're having trouble even connecting with them. But then bringing that into some kind of display, and then acknowledging that this is my process, this is the journey, this is the experience. And I kind of look at it as you're living the loss. Like your bereavement is where you're actually living out the loss in your day-to-day life. And I wanted to show a picture here that you can get a glimpse of, where this is 4,000 pounds of granite in this sculpture. And I believe it's a good representation of the way I would visually try to maybe express the way I feel grief. And that so much of it is this very heavy weight that's connecting me to the ground, that, but it's also this separation of self, and it's kind of this caged in feeling. And so I don't know if, and when you're looking at this, it might trigger some of your own thoughts. But I think the heaviness of this is the importance of, sometimes when you're working with somebody, all of these terms don't help, but an image may be exactly what they need, or that's how they may, you may want to give them an option of, here's how I could express this to you. And so if you had a little piece of blank paper there, you can take a minute and try to draw something of your own. It does not have to be this detailed, but what kind of image would your kind of physical or artistic representation of grief, what would it look like? And how would that help you communicate that to another person if needed? And so I wanted to focus on I don't want to overwhelm everybody with too many symptoms of what can come from this. And I pulled out this diagram because it focuses on, I think, pretty much what can happen at any age. But we're working with our population where we're an aging generation. We're dealing with individuals who are handling grief or have handled multiple losses throughout their life. And that would be of family and friends, but everything else that we've talked about that we were not able to cover today. And so it can be very confusing to see what part of an elder's presentation or an older adult that you're working with, if they don't come in directly for grief, it could be hard to understand what some of these symptoms mean because you can see the abundance of the different areas where your body will start to malfunction from pre-grief or pre-loss. So post-loss can have a huge psychological and physical effect on an individual's body. It can come along and looking a lot like a state of depression. Behaviors, maybe decreased ability to put any energy or maintenance into taking care of themselves. That's also a level of like fatigue, and there's new notions of having a grief fatigue where you're physically and mentally drained and exhausted after experience the loss of something significant in your life. And you can also see some respiratory symptoms that would be really difficult to try to understand if there's a medical condition going on. Increased behavior like substance use. So there's all these other areas where you could see an individual or be working with them, for example, maybe for a substance use disorder and their increased use of alcohol, and focusing only on that behavior may be misleading if we were to look deeper as to what could be triggering that behavior. The feeling of anxiety or loneliness from loss could be related to that behavior of increased drinking. And so this is part of looking at the range of what somebody can go through. And then some of the complexity of some people experiencing some relief after loss, focusing maybe on resilience and strength. And sometimes in our society, people are so focused on the hurt and the pain that we feel like maybe it may be abnormal or shameful to show gratitude and relief and focus on that different aspect of loss of life. And I think that's a really important distinction that we want to make today when looking at the difference between a westernized model of handling grief versus an indigenized or even a spiritual model.
Lonely hearts. Doctors have a warning, though, for people experiencing heartache. It's something called broken heart syndrome. WRAL health reporter Grace Havo spoke with a local cardiologist about this very real and largely unexplained condition.
No, I'm not talking about this kind of heart. I'm talking about the one inside your body, pumping and keeping you moving all day long. While the name may sound lighthearted, broken heart syndrome is a very real and sometimes deadly condition. Cardiologists here at UNC Rex say they see patients for every week.
It's been increasingly recognized over the past 20 years. It's basically a heart event that happens in response to a really strong stressor.
As Dr. Christopher Kelly explains, it could be a physical stressor like an infection or injury, or an emotional stressor like grief after losing a loved one, or a tough breakup that lands you here.
For reasons that aren't totally clear, but probably involve really high adrenaline levels in response to that, your heart can actually become dysfunctional and you can develop heart failure.
It's more formally known as a stress cardiomyopathy. It occurs when the heart suddenly stops pumping properly, and it can often be mistaken for a heart attack.
They can even have in their blood sort of chemical evidence of a heart attack. And so we rush them into the procedure room expecting to be treating a heart attack, but the arteries on the heart actually look normal.
Women tend to be diagnosed more than men, but Kelly says it's still unclear exactly what makes someone more at risk.
It can happen almost at any age. So we see people, in their 20s all the way through their 70s or 80s that develop this. There's unfortunately not one specific thing that a person can do to prevent themselves from developing broken heart syndrome. With that being said, stress in general is a contributor to heart disease because it raises your blood pressure, and we think it also causes inflammation in the body.
Doctors say you should also make sure you're getting enough exercise every week and eating a balanced diet. Kelly.
So that is this is just, I think, a good video that really pulls together how the physiological response to a loss can be so detrimental to some people. And I think the bigger part of what I want people to really think about is that this can look a lot like somebody who is experiencing panic, having a panic attack following loss. That's another really a really big symptom that a lot of people are not talking about, that it could be very normal to start to feel that anxious response to loss of somebody and having to face mortality of somebody that you love or care for. And it does, a lot of people start to look at their own mortality and the inevitable that death is part of life. And that can be so stressful for some people when they're faced with that reality. And so I want people to be aware of it. And I do worry about our Indigenous people because stress alone can put you at increased risk for this. And they're really looking at, if you're a healthier person, if you're eating well, if you're exercising, if you're managing stress, that could be maybe one way to try to keep yourself healthier during these times of real extreme stress, such as loss. So this is where I really want to blend our Western medicine with what we're trying to do to help our Indigenous people to look at how do we try to prepare ourselves, even just physically, for something that could really shock our system and increase these chemicals like adrenaline and cortisol, which are stress chemicals that our body's not meant to be flooded with these chemicals. And how do they know about this? And not to have it scare them, but to have them focus on the whole picture of preparing for this type of stress in our life. They're also looking at beyond the heart and having this increased stress response. It's lowering the immune system. So it's, again, those same cortisol levels and adrenaline, and being under a state of chronic stress or a state where you're experiencing high stress could lower your ability to fight off infection and keep your body healthy and feeling well. And so I think that's another way that we want to talk to our Indigenous people and educate them and really get them pulled in on our physical wellness throughout loss in our community, throughout trauma, and get them to look at a bigger picture of knowing that these are all real things that a body can go through when we're not focused on kind of always preparing and feeding ourselves well and moving well and allowing ourselves to de-stress. Part of high stress and anxiety that's really prevalent in our Indigenous communities. So I think we're all at increased risk for this. And so I just want to get into a little bit about when you have grief and loss of somebody. Not everybody experiences this the same, as I'm sure many of you we've already talked about, but you're thinking about it. It's this presentation really, I think, is part of where we're trying to help people understand and try to bring some organization or some expectations and relief and in something that can feel like chaos. And so one thing to consider is anybody's experience to loss will have much to do with their level of attachment to that individual. And this is important because it's something that I think we can invalidate for others we maybe don't recognize, and we don't really understand how an individual is mourning the loss of somebody that they either felt very securely attached to, and that they had comfort, they were provided with a good, loving, supportive relationship, and then the loss of that attachment, that pulling, that severing of that physical ability to connect with that, will all impact their process of grief and how they mourn and their level of bereavement, and even their ability to healthy be able to integrate this loss in some kind of way that can be something that aligns with acceptance. And we're going to get more into that as we go down in the presentation. But when you have an insecure attachment style to a caregiver or to a person or this attachment, it can make it hard to really integrate and find that peace. If you're struggling with that connection to that person, if there was hurt, if there was abuse, if there was ambivalence or back and forth in this type of relationship, it could be a lot more to process when you have a loss, because there could be so many mixed feelings that are maybe counterintuitive when you lose somebody that you care about, but the attachment shows a history of previous hurts with this individual that can then come up and complicate the grieving process. So there is something that we're looking at when we're trying to categorize grief, and there's different categories, and one is when you feel like you're expecting, where you have some time, you're anticipating that that somebody's going to die, somebody that is close to you, that you will be losing somebody. And so when you're expecting that loss, I guess in a way we should all be in this phase, because I think that reality of I'm going to maybe lose you one day, or lose myself. It's one of us are going to, separate from each other at some point in time. But we tend to not really live in this mode, because most people, we try to function and not focusing on death and loss. We try to focus on life and living, yet somehow we can fail to really anticipate and prepare for losing somebody and looking at how our life could look without this person. So if there are differences, if people have this opportunity, for example, in a terminal illness, if they have time to process that and acknowledge that this loss is coming, it's soon, it's something that is not far off in the distance, it's not a what if, it's and sometimes it's a when, and the when is coming. So it's forcing people to, or it can force people to really sit and ask some of these questions to themselves. And I think it could offer some people time to maybe seek some closure, or even to start to identify how their life will look and prepare themselves. And again, this always doesn't happen, even if there could be, and I think in a way our medical communities may really help us be in denial about this, because they're focused on saving lives. And I think it's really hard when somebody's in that terminal stage, or if they're dealing with a severe illness that is getting worse over time. The family, somebody may not ever have this talk, where they're looking at moving towards a hospice and ending life versus trying every procedure to save life. So I think this is a complex conversation, or even for family or friends or a loved one, they may even know and still not anticipate it, even though they were living it. So these are just different options, but it's more expected. We're more faced with the reality that it's coming. And in general, it's really difficult to say is something a normal grief reaction, but common grief. Typically, and I think this is one of the conversations I have with almost every single patient I work with, whether they're coming in for grief or trauma or anxiety or depression, is eventually I will have a conversation with them. I would say the most common fear of people that I work with is fear of losing somebody they love. And that many times they will say to me, I wouldn't be able to survive that. And that's where I have to pull out my my CBT and my belief in the way I was raised and brought up, and my and try to help them understand that human nature, we're meant to survive this, even though we're worried and we're fearful, that we are meant to survive the death of our loved ones, the death of others. Otherwise, our whole world would be wiped out, because I believe most people feel that. And I'm surrounded by people who survive grief every day. And so most people were designed to survive. And so grief, usually if it's going at a rate that they feel they've been able to accept, integrate, then it kind of goes to it's something that they're constantly carrying, but the weight of it may shift, the size of it may shift, but it's being able to somehow resume back to some kind of quality of life that when you experience that grief and loss and those symptoms that we reviewed earlier, where you could be anxious, sad, fatigued, withdrawn, doing maybe hurtful or harmful things to yourself during that time, that after a period of time and adjustment, that you would go back to a way of living where you can adapt and change in a way that is allowing you to still enjoy life through the death of the loved one. And so in this, sometimes people, and again, it's not that easy. There could be inhibited grief where it's the grief isn't like really expressed or felt. It's more like an individual may really look for routine. They may want to go on with their day, get really busy at work, or they're really just shutting down that full reaction to it. In mass grief, this is where they're intellectualizing and forcing down the grief, and it may then later present not as an emotional but as a physical symptom of feeling unwell, sick, tired. And then the other reaction that some people may commonly fall into is delayed, where they're postponing their grief. And I feel like I share this a lot with people, and it's not just with grief, it's with trauma as well, where I say your body and your mind will only give you what you can handle. And it will come in times when you're feeling that you're more able to cope. So delayed grief can go for weeks, months, years. And when we're looking at the other type of grief, there's complicated grief. And this is complicated grief is where I guess you would compare that to what we just call like your average grief, or something that's considered somewhat normal. And this is where the grief is going much longer, that that it isn't going from a huge heavy garbage bag full of feelings and dysfunction down to a purse that you can carry with you to work, or out with friends. This is where the grief is. The other thing is usually that's done in a period of time that's within that first year or so. And then so when you start to getting something that's called prolonged grief disorder, that's where it's more of a complicated reaction to this loss. And so this is where it's starting to really interrupt your identity, and forming who you are with the loss of this person. So it's really having trouble to rebuild and formulate and perform who you are without this person maybe telling you, reinforcing that, just being a big part of building you and helping you function during your day to day. You may have a person with prolonged grief may really struggle to bounce back from that. And they may feel like their identity, they may feel disconnected from themselves or struggle with their values or what they should be doing without this person to kind of be part of that process. And so they start to really struggle to get back into their daily life. They even struggle to try to create maybe a new type of life without this person. So they really feel like this is ongoing, painful. It's not getting better with time. Maybe people have told them that. Maybe it seems to be getting worse with time. And it seems that this is starting to be more of the way they're functioning now than they really can't see pre-functioning before the loss. And so it's related to feeling numb and disassociated. Now, that's something that we use a lot in the field of psychology when you're talking about a mental and physical separation. And a lot of times that can happen when you have something traumatic where it's just too much for your body and brain to feel all at the same time. And so it's kind of putting you on protection mode, but it can feel really like a separation from yourself and inability to really connect with others or feel safe to feeling any feelings at all. And so individuals can, in this process, may be really avoidant of any reminders that this person is physically gone. So they may avoid any of the rituals or that mourning phase. They may not display the grief because they're really struggling and preoccupied with the loss and really struggling to find that meaning in their life now that this loss has taken place. So this could be something that could feel really isolating and lonely because it's a smaller portion of people who actually experience this. And it has to go on for 12 months or longer, and this can go on for years. I just want to show you an example of a questionnaire that could be used, and this is in a JAMA, the psychiatry journal. And so this is something that can be filled out. But these are some of the questions where it's looking at, is this something that is beyond a bereavement period or a normal grief reaction or a functional grief reaction? So is this something that would require some treatment, which is essential if somebody's experiencing this? And so these are some of the questions that they would ask. And I'm not going to go through them all, but you can read them and you can look up the resource. But I think that the big thing is they're having trouble re-engaging in life. And they're feeling that numbness and detachment. That's that feeling of that dissociation. And dissociation and learning how to cope with that and understand that can be really complex to people who have never been involved in therapy or haven't worked with a therapist to be able to really walk them through that and help treat that. So I just want to show you that that's available. And while they're coming in, like this is the role of a psychologist and trying to look at how difficult it is to make sure that we're treating the right disorder when they're coming in or that we're treating the right symptoms. This prolonged grief can look a lot like a major depressive disorder that can be bouts of depression that's a result of the loss. Different than being stuck in an actual prolonged grief disorder where the impact is different. It also guides the treatment. So those are just some of the things that I want to talk about when you're thinking about what could a psychologist or a mental health professional do in terms of helping somebody with grief and loss examine what they're going through. Because I think it's not a common thing for individuals to seek out therapy. I think it's like this is part of life. I'm grieving. I'm supposed to feel this way, and yes, to a point. Um, and it's also knowing when do we have to get our people maybe more help and understanding and resources that can help them find a pathway through their grief. The other thing is looking at traumatic grief and loss is a very complex, another layer. So I'm kind of going with the complexity. When you add a traumatic bereavement, it's really looking at something where there could be some form of PTSD, or there's trauma associated with the grief and loss. So you have two experiences that are really could be intertwined. And traumatic loss is different than just having anxiety, depression, or PTSD. It's looking at the grieving process and paired with that traumatic experience that you had during that loss. And one thing that researchers have shown is that when they've investigated this in children, those children whose fathers were missing, so they weren't declared deceased, but that had been missing through war, they had more ambiguity and uncertainty of the loss. So they had more severe reactions and inability to go maintain their level of functioning. And that was only one study that I looked at, but the bigger thing I want to focus on is in Indigenous communities, that feeling of ambiguity and the loss and the uncertainty of those individuals that have been missing and unaccounted for, and then how that could be impacting their families and their parents and their children, where they could have much more difficulty going through any stages of grief and loss because they're not certain their person is missing or unfound. And so I think that's where we have to look at how the research is showing they could have a much bigger time having some PTSD or behavior patterns that are really maladaptive and unhealthy from them. They could be really stuck in trying to figure this out. And so this shows, again, looking at when somebody dies from a traumatic incident, and you're dealing with both. You're dealing with, as the survivor, you're dealing with the trauma of what your loved one experienced. And it could be something that was violent, unexpected, and traumatic loss usually is. It's something that was unexpected, you were unprepared for it. And there was a level of that hurt that could bring on a lot of symptoms of the panic and the anxiety and the fear and the avoidance. And it's being able to pull those two together and see that requires a unique model to try to help an individual through that. And individuals who, a lot of our communities don't know that there's this other type of loss. Some people are really stuck in their grief and they're not sure why their neighbor maybe was able to, who had maybe a expected or a normal loss reaction, went through the grief, is somehow functioning again. And they would compare that if they had a traumatic loss, for example, losing maybe a loved one in a motor vehicle accident, they may find that they're stuck and they don't know why other people are able to transition and adapt and change. So they start to feel like, is there something wrong with me? Am I not strong? Am I not capable? Am I doing this? Am I suffering myself on purpose? And so I think that's where this is so helpful, especially for our Indian people, to sit and know that anytime that there is this trauma, it could be worse when you've had history of trauma. So knowing that our Indian communities are already at risk because we have a high prevalence of response to trauma in general, that if there's an individual traumatic loss in your life, that you're at that higher risk. So I think it's really something that a community can build some awareness around. And as a community, when there's trauma, we all suffer from it. We're all impacted in some way because of our close-knit nature and our ability to our lack of ability to separate from each other. We are ingrained and entwined in each other's lives, and a loss in the community affects everybody on different levels. So here's just a few questions that there's a questionnaire also that a clinician would use that looks more at the trauma and how that is affiliated or associated with how they're grieving. And one thing is a lot of preoccupation, guilt, remorse, a lot of feeling stunned and dazed by the death, and a difficulty with resuming to daily functioning, going to work, feeling enjoyment, being able to connect with people. So it's definitely something that, if it's there, would require some help getting through with somebody who knows how to diagnose it and treat it. And also, this is something that is in the DSM, so that individuals can be billed for treatment. And this is where I think it's very important, again, for Indian communities to let them know this is a service that is out there for them. And then to look at how do we start to educate people on the assessment, the need to pull in psychologists and people with trauma work when we're dealing with grief and loss issues that are paired with a hurt or trauma. Oh, there's a really good question about enmeshed relationships, and to me that is there was a question that came up on the chat about enmeshment in relationships and prolonged grief or traumatic grief. And that is one thing when we're dealing with any situation in behavioral health. There's a lot of enmeshment here in our communities. It's kind of like this is the way I explain it, where we become so reliant on our families, our network of people, that it is difficult to understand how do we function without them. And so I think that's something that it's definitely part of a difficulty of building your own personal identity. And so when, for example, if it's your parent or the grandmother, often I'll hear that once the grandmother has passed away in our communities, they had a lot of this overlap. They were involved with each other. There was almost like a rock or a center that worked really hard to bring these families together, and they were really sometimes maybe even overly involved in each other's lives. But in Indian country, there's really no, that's hard to explain that, because that's kind of the nature of how we do things. But it's going to be more difficult to experience a loss when you've built your identity and it's so intertwined with that identity of your family or a core person. So I think that's something to look at and talk about in looking at how do I connect with somebody that I love without over identifying with them. And that's part of maybe anticipating that you will lose somebody. Or you may have your own children where you want to foster independence as well as connection. And so I think that's one of the valuable things that we can learn, is to have better boundaries of building our independence and our resilience and our ability to thrive without each other, while also having our meaningful connections and reliance on each other. And so I'm not sure if the prolonged grief is is longer, but I'm with attachment. That is something that's definitely taken into consideration. Great question. The next thing to talk about is something called ambiguous loss. Now, this is different from a traditional loss. It's a loss that maybe isn't seen or acknowledged. It's considered something that maybe a person shouldn't grieve or bereave or mourn, and it's a lack of support and validation for something that they've lost. And in Indian country, it's important because the same grief could be related to working with an individual who is experiencing their grief from losing a loved one, but no one has ever explored if they have the impact of their historical trauma on the loss of so much of the culture, their ancestors, what our people have went through. And it's really a tough situation to learn how to deal with your personal loss when so much of the loss of Indian people has not been acknowledged, or if it's been acknowledged, it's been in small ways and it hasn't been seen. It's something that we're just now in society, they're trying to show a little bit, but it hasn't been fully displayed, the amount of loss and trauma and hurt that come into our communities and into our bloodlines and into our streams of consciousness that people have to deal with in addition to their own grief. And so this is something on a higher level when you're working with Native people to explore this and allow them to talk about some of this if it's something that they feel that they're dealing with. Acknowledge that and validate that it is a real loss, and it's something that many times it's seen as it's been done, now kind of move on, get over it. Absolutely not. So that's where the grief starts to be broken down because it's not valid. Society doesn't think it's important. Another consideration with ambiguous loss is like a individual, a woman having a miscarriage or loss of life that's it's really people are struggling to understand this grieving and mourning process. And so it's seen, it's not seen, it's felt, and it's almost as if society says, well, you don't need to feel that. And so this could be really complex, and it could be another layer that you want to check in with when you're working with individuals, because this past grief reaction needs to be normalized and explained, and then they're able to integrate it into maybe why they are struggling with their current loss. And I want to look at an indigenized perspective. When we think about grief, it's really it's different because it depends on how much traditionally individuals in the community know and are working with their healers and their helpers to understand loss. So most of the time we are understanding loss according to grief, just the way it's shown to us in social media, just the way it's westernized. And so we're looking at mourning and trying to feel these and do these rituals that maybe aren't making exact sense for us, or maybe not really helping us. And now is a time where looking at historically, how did Indigenized people, how did they deal with grief and loss? How did they deal with burial? How did they deal with those attachment and that level of community and loss? And how do they view life? And so in my culture, what I've learned and from working here is that, that Creator breathes life into us, and that our life it's circular, it's ongoing. There is no just and you're gone. This is a journey that you're on in your physical form on earth. until you're at that winter stage in life, if you're able to make it all that way through, that your part of the journey is to learn and to teach what you know about your ancestors, your values, your beliefs, and pass that on. And then you're able to transition. And that when you transition, you have these 4 days after death in order to make that journey. And there are different ceremonies and different ways to process and help your loved one get to another phase. Now, this is a different way from having maybe a funeral, a Catholic mass, or whatever religious way, or however people are doing it. So it's learning that to try to maybe integrate some of this or ask individuals to, it's all part of going back and trying to learn and reclaim and maybe integrate some of it if it's helping them heal, or if it's helping them understand that there's another way to look at life and to look at death as part of life, and this connection between our earth. And with death, your physical form is returning to the earth. And so that's one of the things where it can be a little complex to do therapy with some individuals if culturally they've been told that when you kind of try to hold on to a spirit or somebody that's on their journey, that you could be really interfering with their ability to move on and get to that place where they're able to connect with their higher realm and their higher self. And so that's something that we have to keep in mind. It's just part of this complex process of giving space and time and exploring different ways to connect with people and understanding what could be helpful for them, and what ways do they want to look at different areas and incorporate that into what you're doing with them, if in terms of our work as psychologists. And this is really relying on helpers right now. And those are those elders, those wisdom keepers that I try to work with. I have one teacher named Debbie, and I meet with her very often. I've been with her for over 20 years. And this is what helps me learn and try to integrate and be mindful of what I know as a psychologist, what I've been taught, and what my community is teaching me. And it's helping me understand the grieving process and the journey more in terms of a circular connection versus a linear, where we're aging, birth, aging, and then we're declining. And as we age, instead, it's we're coming full circle as we age. And so a westernized model, most of us are pretty familiar with these common 5 stages of grief. And this is something where this is very linear. You can bounce back and forth in these. It does help some people at least connect and feel valid in some of their feelings, but it really isn't the exact model that works for everyone. And I think that's where we definitely want to be careful when we start labeling and using on something that is so well known, because it's highly individualized, and there's so many things that it doesn't take into consideration. There is in addition to this, there's research where they've partnered and added a 6th meaning and a 6th stage where it's finding meaning. And I think that this is really similar to our Indigenous, like where we can connect with this, is that process of finding meaning in somebody's death, finding meaning in some of our hurt, our suffering, and our tragedy. This is an area where we can learn to integrate and rebuild and try to pull something that can help ourselves and our community from that loss. And when an individual is stuck in those those griefs, you know, that grief cycle, the linear, they can feel like they're in a maze and they're just going around and around because they haven't transitioned through that feeling of the real acceptance of loss. So in order to get to that level of finding meaning, it's really finally being able to fully accept that there is this real physical loss that you are not able to access here on the physical world. And that acceptance can start to open up that grief maze where you're able to then start to find that beautiful meaning and integrate. The next one that I think is really going on with our indigenous ways and can work for lots of people is looking at the reality that you know, a lot of people will say, well, it gets better with time. You know, a lot of people have said it takes about a year to feel better or to feel somewhat normal. And so then people have an expectation that time heals all wounds. And in reality, what they're finding is that the grief may not shrink, it may stay with them, but it's a more of transitioning through life and trying to maintain a connection with the person you've lost and continuing to feel like you're bonded with them versus fully separated. And with the continuing bonds, it's looking at being able to really create things in your life that can make you feel connected to that person you've lost. Any way that you can integrate and bring them into your day-to-day. And there's so many things that we can do with our community or with our individual patients to give them ideas on how do they do this. And to me, that gives them that circular feeling of staying connected and that everybody's on this journey and that your loved one is journeying on out of the physical realm. And so what are some things that you can do while you're here to maintain that bond that you have, that connection, while still building up your individual ability to feel okay, to start to enjoy your life and to make sense and build up who you are without that person and to recover from what's needed. And so I think the last slide that I'm looking at, I think we're right at the end of the time, is I went through a lot about trying to understand and assess this as a psychologist because it's very important to understand that assessment piece because it will guide your treatment. And there is treatment that we can use to help individuals get through traumatic grief and loss, and that the work is needed. And sometimes when there is that trauma, you need to have that specific trauma work in addition to the grief work, and balancing that all out while also being very mindful of the Indigenous component of their life and what that has to come in and guide your overall conceptualization of the entire treatment process. So it's really about getting to that phase and being able to go into treatments that can then guide and help them through this.